Hi everyone, welcome to researchmd.com. This is Dr. Pramil, and I work first let me introduce myself. I work as a Chief Medical Officer and Associate Professor of Medicine in one of the large medical schools in the United States. So we're going to continue our journey into the herbal medicine. Again, the whole purpose of this presentation, not to put the herbal medication down. We clearly know a lot of good beneficial properties of herbal medication, right? Everybody agrees that. But at the same time, it's important for the public and the treating physicians to know about the toxic effects of the herbal medicine. Like any other drug, herbal medicine also can have complications, okay? So if you know those complications, you can stop and you can get the immediate medical attention as it needed. Otherwise, the complication can lead to death, okay? That's the whole purpose. So let's look at our drug today in the herbal world. The herbal medicine we're going to discuss is Aconitum. Mainly it's grown in the China, in the Asian countries, but it's in the medieval literature about the benefits and the toxic effect for a very long time. They were using this is a poison as an arrow for like hunting purpose in the long time ago. Now, when we look at this slide, why do we have a picture of Shakespeare and Harry Potter? Shakespeare, in his novel Romeo and Juliet, mentioned about this drug. In the Harry Potter movie, in the Hogwarts school, they were talking about the poisonous effect of this drug. Now, what is the component in this herbal medicine causing all these complications and the benefits? It's actually called Aconitum, okay? Remember that. Now, let's first look at what are the uses. What does people use this herbal medicine for? They use for like fever, pneumonia, influenza, toothache, joint pain. Those are the main uses for this herbal medicine, okay? Now, we've been doing like a lot of literature research, like all of our presentation purely based on science. The first study we looked at is the evidence-based complementary medicine published. It's actually published by Wu, and they looked at around like 445 studies. And the number one toxic effect, my friends, is about cardiac side effects, okay? Lots and lots of arrhythmia, starting atrial fibrillation, ventricular arrhythmia, sudden death, and all of this caused by. And also they mentioned about all other system like respiratory system, gastrointestinal system, neurological system, hematological system, renal. All of those systems are affected by this drug, okay? This drug, we have to be very extremely careful because of the all these complications develop in any system, you name it, okay? Now, when we talk about, there was a study, an interesting report came from China about, I think there's equivalent to CDC was called about, there was a birthday party was going on. 15 people developed the poison, they were taking this Aconitum, they were using like a herbal drink. And initially the presentation was like numbness and tingling near the perioral area. Eventually what happened is like out of 15, 5 people died. So clearly shows like the toxic effect of this drug. Okay, now let's look at another study looking at the clinical aspects of Aconitum, and they looked at from their standpoint, this other toxic effect. Gastrointestinal can have nausea, vomiting, diarrhea, abdominal pain, okay? And then when we look at the other system is mainly again cardiac system and the neurological system. Cardiac system, we already talk about this arrhythmia, ventricular tachycardia, hypotension, tachycardia, and sudden death. All of those kind of, again, number one, if we can think anything about this drug, is the cardiac effects, my friend, okay? Now let's look at another case report. Is an accidental poisoning of this drug. As a 54-year-old, loss of consciousness, decreased blood pressure, ventricular tachycardia. The patient ended up having a defibrillator, and then eventually the patient came back. Okay, now let's look at the other case report about a 92-year-old female. She was taking this drink called Fuzi, F-U-Z-I, and then she developed all the complications. The next case report we're looking at is a 22-year-old was taking the medication and the herbal medicine, and they developed initially again periorbital numbness, tingling, and the heart rate went up to 150, a lot of arrhythmia-related complications. Next case report we looked at is a 46-year-old female after taking the herbal medicine. Mainly, it started with abdominal GI symptoms, abdominal pain, nausea, vomiting, and then all the cardiac effects come in, including ventricular tachycardia. Okay, the next case report about a 57-year-old patient after taking the herbal medication developed interventricular conduction defect. It was like reversible. Okay. And the next case report was about a 48-year-old female taking the herbal. They were taking like a herbal wine, this medication. And this patient also a very interesting finding. In addition to the cardiac toxicity, this patient have polycystic renal hemorrhage. That means, a hemorrhage or bleeding into the kidney was noted in this patient. Now let's look at the next case report. It's about an 18-year-old. What he did was he took this tea-like drink from this Aconitum, and unfortunately the patient died of the arrhythmia. Sad case. Now, the next case, a 56-year-old patient was drinking and then went into drinking this herbal medication, went into respiratory failure, and then seizure, a lot of CNS complications and all that too. Now, the next patient we looked about is all this case report, like a 20-year-old. His father was taking the homeopathic medication, including, using Aconitum, and the kid went into ventricular arrhythmia. Fortunately, the patient survived. Again, this medication or the herbal medicine Aconitum have many toxic effects. I have never seen so many complications of any other drug. They call, I think, in the ancient days like stepmother's poison. So be careful. Remember all this toxic effect, especially the cardiac effects, my friend. That's what can lead to the death. We'll continue our presentation next time. Please support us by being a subscriber. Greatly appreciate all the support you have given us. Thank you so much. God bless.